Dr. Lindsay Trottier. I am a doctor of acupuncture and Chinese medicine practicing in San Diego, California. I am a premier level balanced method acupuncturist, and I have been studying balanced method acupuncture since 2007 under Dr. Richard Tan and Dr. Eileen Han. Today, I'd like to talk about how acupuncture works for shoulder pain. Recently, I had 3 patients come to my clinic with different types of shoulder pain, and I'd like to tell you about how they each progressed. So the first patient I had come in was an 86-year-old female. She had chronic shoulder pain that she had gone to her orthopedic surgeon for. She had gotten a corticosteroid injection into her shoulder, and instead of getting pain relief, she had excruciating pain afterward and was losing sleep because of the pain. She presented in my office with 10 out of 10 pain. The first treatment was pretty rough for her. She found the needles very uncomfortable, but we could see within seconds that she was getting more range of motion. I was able to convince her to continue treatment. She has to date come in for a total of 18 treatments. She started on August 7th, 2020. I had her come in for 3 times a week for 5 weeks. Her original pain was 10 out of 10. By her 12th treatment, so within 1 month, she had full range of motion in her shoulder, whereas before she could barely lift her arm up from her side. She could hardly sleep because of the pain. She couldn't do any household tasks. She couldn't dress herself. She needed a lot of help from family. By the 14th treatment, she had no pain in the shoulder, and we have decreased her treatments to twice a week. She's still coming in because she has other places she has pain, which have also been resolved by acupuncture. And she's still struggling with a lot of fatigue from the sleep she lost when she had this original 10 out of 10 shoulder pain that had started in July. So she's doing really well, but we're still continuing treatment to make sure she's stable. I had another patient come in. Actually, their first visit was also the same day, August 7th, 2020. This was a 59-year-old man who had acute shoulder pain. His pain had come from, I believe he was painting his wife's office, and he felt a muscle pull in the deltoid area, the posterior deltoid. And he had 7 out of 10 pain. He also had limited range of motion in the shoulder. By the, the 8th treatment, I had him coming in twice a week. By the 8th treatment, he had full range of motion in the shoulder, and by the 9th treatment, he had no more pain in the shoulder. He had continued for twice a week to make sure his results were stable. We also started treating him for regulating his diabetes. He was having high blood sugar, and he was having lab values done to check his A1C levels. And with acupuncture and then starting him on Chinese herbs, we have been able to lower his blood sugar, which is great. He remains stable, and he has begun painting again. He is doing exercise, and he reports that he is no longer getting the shoulder pain, just some regular muscle tightness that is quickly relieved with acupuncture. The third patient I had was a 31-year-old male. He actually came in for some knee problems he had been experiencing, but I always ask my patients, what else can I help you with? And he mentioned that he had a shoulder injury 3 years ago that was unresolved. He had limited range of motion and some tightness and occasional pain in that shoulder. Within 1 treatment, his pain was gone in his shoulder, and he had 75% more range of motion. He was shocked. He thought nothing could be done for the shoulder at this point. So he was very pleased. I saw him a few more times. His knee problem had been resolved, and he was happy with what happened in his shoulder, so he decided to stop treatment at that point. So these are the many ways that acupuncture can help all types of patients in all kinds of circumstances. You know, whether the shoulder pain is chronic, acute, no matter your age, no matter your health, acupuncture works for shoulder pain. If you'd like to know more, you can book a visit with me at lindsaytrottier.com. You can call or text me, 619-719-1768. I am practicing in San Diego, California. I do offer virtual consultations. You can message me about that. Otherwise, I look forward to meeting you soon. Thanks, have a great day.